So stroke transition, fluidity, and continuity are very important. Avoid the popliteal space or fossa, and then go up in effleurage. If the thigh is a larger thigh, you can do it this way, or you can do it this way. Just try to keep your hands linear so that your hand is straight with your arm. You want to minimize torquing or bending or twisting forces on the wrist. Okay, so all the way up, all the way up. Nerve stroke, shake it out. Now, since we already worked the foot, I'm not going to spend much time here. I'm just going to make sure it's lubricated, make sure the bolster is supporting it. A few knuckle strokes, and I'm done with that. Okay. Now I'm going to come over to this side. Going to work the left leg. Triangle, holding, 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 and tucking, tucking. Okay, so bring your lubrication down. This is not down quite low enough. You don't want to have the drape down here. You miss working on a good part of the body that way. Okay. Open up the medial lymphatic chain again. Split the two heads of the gastrocnemius. Effleurage, effleurage, petrissage. Notice my hips, the power for all strokes comes from the hip, from what they call in shiatsu the hara, which is 2 fingers or 2 chun below the navel. Ringing, leave some space. This is a push-pull, push-pull. If you want to work the Achilles tendon specifically, you could do that with some small strokes here. These are deep effleurages. Some people who run a lot are very sore here. Okay, and now that I've worked the lower leg, I'll go up to the thigh. More lubrication. Sometimes people have little lumps and bumps from previous injuries. If you can work them out without causing too much pain, fine. Face the table, do some effleurage. Some petrissage, rather. Petrissage. Some effleurage. Back. 1 or 2 full effleurages, going light over the popliteal fossa. Some nerve strokes. Done. Okay. The foot again, we already did that, so I'm just going to do a few knuckle strokes. Done. Now I'm going to reflect her draping to expose her torso. Okay. Tuck under the underwear. Okay. And I'm going to lubricate her back. If you have a way to warm up your lubricant, whether it's oil, lotion, or cream, that's fine. Clients always appreciate it. Now notice she has a habit of having her shoulders up here. She carries her shoulders very high. So one thing that I want to do during the course of working on the torso is to just remind the shoulders they belong down here. Down here. So now I'm going to warm up with some effleurage. Always your first stroke, effleurage. You okay? Weight transfer. Some petrissage of the superior trapezius. You can do it together, or you can alternate. Relax. That's it. These fingers, these 4 fingers, are stabilizers. The work is being done by the thumbs. Relax. That's it. You can work hand over hand. We're not doing deep tissue work today. We're just doing basic strokes. This is more along the lines of a relaxation massage rather than neuromuscular or deep tissue. Chucking. I'm going to transit now and come up to the head, and I'm going to do effleurages this way. This is a nerve stroke coming back, leaning in, therapeutic down here. And some work with my thumbs in the lumbosacral area, more the sacral area. Okay. Some leaning in the supraspinous fossa. Lean back. Change hand position. Lean in. Lean back. Lean in. Lean back. Lean in. I'm at the AC joint, a little frictioning. Okay. Okay, so nerve stroke, I'm going to cover her up. And now I'm going to work her neck. For this, I'm going to put the face cradle into flexion. That will open up the neck and give you a little more room for your hands. Now remember, I already worked the posterior neck. So this is good. It's the second time we can get at it. I'm doing some petrissage here. Just picking the muscles up off the bone, off the vertebral column. Come around to the head with the back of my hands. Come up to the occiput, down to the AC joint. Lighten up when you come down to the shoulders. Up to the occiput. And then I can do some friction. Little circles, just pick an arbitrary spot in the suboccipital region. Work it. If you feel any cords or rubber band, taut bands as they call them, you can work them. Remember, always stabilize with your non-working fingers. This is transverse friction. This is longitudinal friction. Okay? Longitudinal and transverse or Cyriax friction. Okay, so I'm going to say goodbye to my client. I'm going to give her a little rocking. And we'll let you relax a few minutes, and then you can get dressed. Thank you.